Well, we have a number of things that we do at St. Joseph Hospital to treat cancer. We do embolization of various parts of the body, but including the liver, which I know my partner has talked to you about. But in addition to that, we can also burn tumors. And if disease is limited to the liver or the lung, then we can perform an ablation procedure. And what ablation does is, this is an example of an ablation needle. With an ablation procedure, you heat a volume of tissue. So if you have a volume of tumor and you can put this needle into that volume of tumor, then you can expand the needle like that. I don't know if you can catch that on film. But what it does is it basically forms a sphere, and that sphere can then create a round area of heat greater than 60 degrees. And it works with an alternating current. Basically, a power source connects back to the back of the needle. It creates an alternating current, which makes the molecules in the tissue vibrate or oscillate back and forth extremely fast, and that creates frictional heat. If we heat tissue above 50 or 60 degrees Celsius, it kills it. It doesn't matter whether it's tumor or normal. If one hand was pure tumor and one hand was normal hand, you put them both in fire and you left them in fire long enough, they're both going to burn off. Heat will kill either. In this situation, all we have to do is deliver the heat right to where the tumor is. So we have a variety of needles, come in different sizes, different straight versus this is an expandable needle. And as long as a tumor is limited, meaning if you have 1 or 2 or 3 or 4 or 5 lesions in the liver or in the lung, then as long as it's a finite number like that, then we can go ahead and treat those, trying to kill that lesion and get a cure. If somebody has 25 to 30 metastases of the liver spread throughout the liver, that patient would not be a candidate for an ablation procedure. But if somebody has limited disease, particularly in the liver and the lung, it can be done. It's done elsewhere as well. We treat bones for bone metastasis for pain with this and so forth. But again, it's a much less invasive procedure than the alternative, which is, in the case of a liver, a partial hepatectomy is a big surgery, it's a big recovery. This procedure, we typically will keep the patient one night, but basically it's just an overnight stay, go home the next morning, and if it's a patient who is an adequate patient for treatment of this, have potentially cure the lesion right there. So there's a lot of growth in cancer. This was not out there, 15, 20 years ago when I started, and there's going to be new things coming down the pipeline as well to treat cancer. And certainly there's a lot of growth ahead in the field, and that's something that we've been doing here since about year 2000, I think, was the first time that I did an ablation procedure. I actually did it on a young girl. It was a benign tumor in the bone. She was on an athletic scholarship to a school in the Midwest. She had seen an orthopedic surgeon, and he wanted to do the typical treatment, which involved taking out a large portion of the bone. Once again, she was on an athletic scholarship. So her dad researched it and found some reports out of Harvard about treating the lesions with a radiofrequency ablation procedure. It took a lot of convincing for him to have it done here, since his daughter was the first patient here. But it was a fantastically successful procedure.